Facial contouring, it's all the rage. We see everybody doing it on TikTok and Instagram. Well, what if you just don't want to do it every day and you just want to wake up beautiful? Well, it can't be done. I'm telling you. Dr. Ward and Dr. Powers are here with me. Hello, you two.
Hello.
Good, so we see you every single week for Doc Talk. You brought Dr. K a couple times, and now Dr. Powers, so welcome. Welcome to Utah, too. So introduce Dr. Powers for us.
So Dr. Powers, it comes to us from Irvine, California, where she did her fellowship.
Okay.
And a close friend of mine, facial plastic surgeon, said, you cannot let her go without getting her to join you. And so we feel so lucky to bring her to Utah,
Yay.
and she's here, and she's doing amazing. She's only been here 6 months, and already, like, our patients love her. She does the most amazing work. It is such a privilege to be able to work with her.
I love it, and you're doing all the facial plastic surgery that Dr. Ward does, basically.
Yes, facial plastic surgery.
How fun. Okay, well, you two, your team is growing, which is a testament to you and your practice also, because you've got a lot of people coming to join you, and, you know, we've heard from patients, too. So walk us through facial contouring, because it's a big deal now.
Well, you talk about, people do makeup facial contouring all the time, trying to, highlight their cheekbones, make the direction go to your eyes or to your lips. Well, why can't we do that surgically? So you have to do that less, or maybe not even at all. So the technique that I developed is kind of a cool technique. It involves addressing the buccal fat, B-U-C-C-A-L fat. Instead of taking it out, what I like to do is I like to transpose it. So take it from here, put it here. We don't want it here.
It's just really right here by your cheeks?
Yeah.
Okay.
We don't want the fullness here. We'd rather have kind of the fullness here. Doing a little bit of liposuction to make your jawline stand out better, make your cheekbones stand out more.
Brilliant.
And then addressing some, if we need to do something to the bony structure of the mandible or to the cheeks, we do that as well. So it's kind of a comprehensive way to give some facial rejuvenation to people who maybe have like a round face and they just are sick of it. They don't like it.
Absolutely. I come from a family of round faces, so I get it completely. And some people are born that way. Other people, it's age. And we're losing it in certain places, right? So you really focus on giving them what they want.
Yes, so facial contouring, when they come in to see us, we really make a customized consultation. We talk to them about where we need to enhance, where we may need to subtract a little bit. And sometimes that enhancement can be done with surgical results, where we're doing that with maybe fat, but you could also think about some non-surgical results as well.
Absolutely.
Some filler or some Botox as well, just to kind of give the whole face a little bit more harmony.
So there are people that are obviously still scared of Botox, still scared of surgery, right? Walk them through why, I mean, for me, now that I've done it time and time again, I'm not scared at all. I'm like, you put it in whatever. But just walk them through maybe a first patient.
I think sometimes patients come in and they may think, oh, I don't want to look unnatural. I don't want to look like I'm a balloon, right? I don't want to look overfilled. And oftentimes those patients may actually have been treated with too much filler rather than a surgical option, which is going to give you more of that natural result as well as a little bit more of a longevity.
Yeah, absolutely. And I mean, there are people who they're going to go overboard, and to each their own, but you guys really pride yourself on trying to keep somebody look natural. I love seeing some of your patients before and after photos. They look like themselves, just an enhanced version.
So just like Dr. Ward was saying, we can take some of the fat. If somebody looks in the mirror and they say, every time I smile, I'm really seeing that I have a really full lower cheek. You can take that fat and actually put it into the area where we want the cheek to be more enhanced, which is this area. If you think about people doing contour in the mirror, that's what you're looking for, is a highlight here. You're looking for a little bit more of a sculpted area. Same thing with the jawline. We can take some of that fat out. We can then sculpt that area, make it so that you look like you have a really snatched jawline.
I love it. I love it. Well, if you are wanting to do something to your face, you might as well at least go in and talk to the doctors. And you guys are obviously doing the surgeries, but then you have a great staff as well that's doing, Botox, filler, all that kind of stuff as well. So thank you guys so much. And a couple locations for you, correct?
Right.
So
Yes.
Cottonwood
Heights is our main one, but we also have a location in City Creek and Mountain View Village.
Fantastic. Thank you so much, and nice to meet you, Dr. Powers.
Yes, nice meeting you.
Grab your phones. You can scan this QR code, and it will take you right to the website so you can learn more and schedule a consultation. Let's check in with Morgan up at the zoo.